Okay, in this video, we're going to go over a series of exercises you can use as a routine to help heal hip injuries and reduce muscular guarding as a result of these injuries. Now, within the context of this video, we're talking about injuries to the labrum. The labrum is a cartilaginous ring that helps keep the femoral head suctioned within the socket as a means of stability. There's a large prevalence of studies that show people who have labrum injuries and tears to the labrum can function completely normal and don't have any pain. So realize injuries to the labrum can heal without surgery. As long as there isn't any massive signs of instability, like you feel like your hip is subluxing all the time. Now, whether it's an acute tear due to trauma, maybe you got hit in the side of the hip and you get an MRI and it shows a labral tear and the hip is really inflamed, or if it's more of a degenerative tear, maybe you have FAI, femoral acetabular impingement, and over time the rubbing of the two bone structures against the labrum has caused a little bit of fraying and a tear. And again, that doesn't always lead to pain, but if you do have a flare-up currently, then this routine is going to help both sides of the spectrum. Now, labral tears and the recovery timelines, it's going to vary, person to person, and the rehab is going to look different depending on the severity of the tear. But this routine is going to be something that's low intensity enough that you can do every single day, even throughout your day, to just simply initiate healing and get the hip feeling better. But you have to understand, you can't just do the exercises in this routine and then continue to train as normal. The majority of your rehab is going to be centered around program modification, meaning what you're currently doing in the gym has got to change based around the ranges of motion that are painful. I'm a huge proponent of training around injury as much as possible. There's a ton you can do even with an extremely flared up tear. You just have to stick to a few key rules. The first thing is you're not pushing excessive range of motion, your end range of motion. Okay, you're going to want to modify range of motion as much as possible. That means if you're used to doing full range of motion squats and deadlifts, you might want to be doing a high box squat, even something a little bit higher than 90 degrees, so there isn't that much compression within the hip joint. And then maybe even elevating plates for deadlifts, specifically a trap bar deadlift with plate elevation. And then, isometric exercises, planks, side planks, hip thrusts, as long as you're not going into full hip flexion at the bottom, so a glute bridge would be more appropriate. Copenhagen planks, these exercises that stay out of that hip flexion and deep hip rotation. If you're into end range flexibility work, that stuff is probably going to have to take a pause for the time being. This could be a shot to the ego, but just realize when you have an inflamed hip, your body's going to tighten the muscles around the joint anyways. There's always going to be this protective tone. So if you're trying to push range of motion and push strength through range of motion, you're always going to have some inhibition. So step one is to stay moving and allow the natural healing process to occur and keep the inflammation at bay. When there's synovitis within the joint, which means inflammation of the synovial fluid within the joint, there's going to be inhibition of muscular strength, and there's going to be muscular guarding associated with that. So while you're doing this routine, you need to modify your exercise routine. And of course, labral tear rehab should be very individualized. This is why I offer online physical therapy and coaching for these sort of things. Lastly, I just want to make a note that a very common issue I see within rehab in general is people try to use exercises that are great for bulletproofing or making a certain joint resilient. So going to full range of motion, doing end range isometrics. We see this in knee rehab all the time. So knees over toes split squats, sissy squats, for people with, past knee injuries. But if you have a flared up knee currently, these are exercises that will really aggravate the issue and keep inflammation in that area. And same with the hip. If you're doing a bunch of rotational exercises, so 90-90 drills, loaded pigeon stretching, a lot of this stuff that is absolutely phenomenal for your hips. And even with a labral tear, you can train these positions down the line when inflammation is not as present and the hip is not symptomatic currently. But while it's symptomatic, while it's very inflamed, while it feels like range of motion is restricted in all planes of motion, meaning if you move into end range extension, end range abduction, flexion, internal, external rotation, and it all feels painful at end range, this is one of the signs of labral tears, every direction is kind of painful, then it's not going to do you any good, and it's just going to prolong the healing time. So save those exercises for when the joint is feeling better. The acute stages, the subacute stages, the initial stages of healing require you to restrict range of motion while still moving through all these planes. Let's get into the routine. You can skip to this section in the video, prop your phone up, and just follow along with me, or you can write down the sets and reps and do it on your free time. But I'm going to go through all of the exercises and kind of narrate them as I go. So I hope you enjoy the video. Let me know what you think in the comments. Here we go. So luckily for this routine, all you're going to need is a foam roller, and we're going to use it for the majority of these exercises. So the first exercise is going to be a side-lying knee roll. So you're going to set up in side-lying, and then you can have your knees directly across from the hips. So I'm at 90 degrees of hip flexion here. Of course, if being in this level of hip flexion is already pinchy and painful in the groin, then back out of it, have your knees below the line of the hips. So here, as you can see, I'm just moving the top knee in front of the bottom knee and then pulling it back so it's behind the bottom of the knee. The entire time you want to be pushing down on the foam roller with that top knee. So we're getting some hip shifting occurring and getting the pelvis moving over top of the femur through horizontal adduction and abduction. So yes, we're getting some slight length in the glutes, but it's nothing very high leverage. We're not getting a huge stretch here. The main thing we want to feel is the adductors, the groin muscles, especially as we pull that top knee back. So we should be simultaneously pushing the inner part of the knee into the roller as we roll it back. So I did about 20 repetitions there. You can even just set a timer for 90 to maybe 120 seconds. We just want a few minutes of just low intensity quality movement. And it might feel like a little bit uncomfortable, a little bit pinchy in the groin when you first start, but you should feel that sensation dissipate over the course of this exercise. If it's getting worse, then that means you have to back out of that amount of hip flexion that you're in. In terms of pelvic position, just keep it neutral. To get a bigger stretch on the bottom hip, of course, you can go into more anterior pelvic tilt, but I would just prefer you keep it neutral. Again, the idea isn't to go into a huge end range stretch on that bottom glute. The idea is to feel the adductors working, feel the bottom hip abductors working as you press the bottom knee into the ground as well, and just get some quality movement through the hip joint. Okay, the next drill, we're working on some hip shifting in the frontal plane, so through neutral, abduction, and adduction. So you're going to have the inner part of your calf on the roller, and then you're going to roll the foot away from the body. This drops the pelvis on that top side, and then you're going to lift into abduction. And then you're going to hike the pelvis as much as you can, so getting the roller toward the bottom of the foot, and then roll it away. It should go to around mid-calf, and then you abduct. So we're doing about 10 to 15 repetitions here. Back and forth is 1. A lot of times when you see side-lying hip abduction exercises done in traditional rehab settings, there's a ton of motion coming from the trunk. So they'll lift that leg up super high, and then you just see the pelvis hike along with the femur. This isn't necessarily bad. If somebody has some low back pain and they struggle to get motion through the spine, then that's fine. I'll actually encourage people to hike the pelvis as they abduct the hip. But for the context of just getting some load through the hip abductors in a more isolated manner, then we're going to want to keep these lift-offs very small. So we're pushing the leg away from the body, and we should almost feel the top side oblique and QL kind of stretch, and then we lift into abduction. We want to keep a straight body line here. I'd say I'm a little bit too hinged at the torso in this example, so we want to see a straight line between the shoulder, the hip, and the ankle. And in terms of foot position, you can just keep it neutral. It doesn't have to be externally rotated or internally rotated. We're just trying to get some loading through the frontal plane here. So we should also be pushing the foot down into the roller as we hike the hip. So when you pull the hip up, you should be pushing the foot down into the roller, and you'll feel the adductors engaging there. Remember, a pelvic hike in closed kinematic chain is an adduction of the femur. A pelvic drop is an abduction of the femur. So we want to couple those motions as we're performing these lifts. Okay, exercise number 3 is going to be a wall-referenced knee roll. So just like we did in side lying in the first exercise, we're going to perform this in a hemi-bridge. So it's not a full bridge with the hips fully extended. We'll save that for later. But it's just a slight hamstring bridge where we're digging the heels into the wall, down into the wall, pulling the sacrum and the low back off the ground slightly, just hovering it there. So we're maintaining some hamstring tension as we go into this hip shift. So basically what I'm doing here is one knee is dropping down and then one knee is moving in front of the other knee. So again, this scissoring kind of hip shift motion where we're getting the adductors turned on, we're getting the femoral head situated toward the back of the socket, but not in a way that's causing any excess stretch in that back of the glute and hip capsule. If we went and did that now, that would be very painful with a torn labrum or a labral injury. So as you can see here, you can see the hip shifting going on. When you're doing this, notice how the belly button kind of turns toward the knee that's below the other knee. So we're getting some of that horizontal adduction happening. Now we don't want to see the pelvis shifting side to side too much. We just want to see it going up and down. So rising and dropping, and that's telling us we're getting this hip shift happening. And I really do like these exercises. Even though they're very low intensity, they're very good for education. Okay, this next exercise is called supine leg tracing. So for about 10 repetitions, we're going to trace the inner part of our foot up the top of the thigh. Okay, so we should really feel the adductors and the hip flexors turning on when we do this. You might even feel a weird hip flexor muscle, the sartorius, kick on in the front of the hip. So we're just getting some adduction, a little bit of internal rotation happening here. So a slight stretch you might feel in the back of the glute, but again, that's not the main goal. The main goal is to just feel some of those front of the thigh muscles working. So we do that for 10 reps, and then we're going to drag the heel along the inner part of the thigh as high up as we can. So we're moving through external rotation and flexion and abduction. So the first drill, flexion, adduction, a little bit of internal rotation. It's more of a neutral hip. And then this one is going to be more flexion, external rotation, and abduction. Now, if you're very apprehensive in the hip, then you're only going to slide that foot up a little. It might only get to mid-calf. It might only get to the joint line of the knee. It might not go all the way up the thigh, and that's fine. So I'll show on this side, I'm staying a bit shy with the externally rotated variation because I actually did have a flare-up in this left hip. I recently was sick, bad fever, cough, chills, and out of nowhere I just had a flare-up in this left hip. There was nothing I did movement-wise that set it off, but who knows, just extra inflammation in that area. Perhaps I was moving differently and I just irritated some parts of my labrum, which is already torn. So that external rotation inflection is actually a bit apprehensive for me right now, so I'm just taking it easy. But I will say, after doing this drill, 10 reps each direction, the hip feels much better, especially when walking. So it's a really nice one. You can do it at your own level, your own pace, your own range of motion. And again, these drills, they're low intensity, but it's stuff that you could do frequently. It's stuff that'll help decrease muscle guarding and joint stiffness, which can definitely add up if you choose to not move the hip. Of course, time will heal all injuries, but you have to stay moving. Okay, if you stay stagnant, then the joint is just going to be way stiffer when pain decreases. So just showing you a little bit of a side view here of, how far I'm getting that heel up the thigh. So again, about 10 to 12 repetitions each side with these. I do think it's beneficial to do both sides, even if you only have one side that's injured, because why not? So I like to finish this with a little bit of supine clams or just, supine butterfly. Just kind of dropping the knees, bringing them back up. If this is very painful for you in the hip, you can leave it out. But this range of motion actually feels quite good after doing that exercise, so I like to kind of test it. Okay, last drill that you'll need the foam roller for. This is a 3-way bridge. So we're going to start with a little bit of femoral internal rotation here to get some of those hip rotators firing as we move into hip extension. So my foot is going to be outside of the knee. This is internal rotation. If it is painful, then you can back out of that range a little bit, but the fact that we're in hip extension shouldn't be too bothersome to the hip joint. So I'm squeezing the hell out of that roller as I bridge the hip up. So really getting the adductors firing, that adductor magnus firing to extend the hip along with the glutes and the hamstrings. Being in internal rotation here, you're actually going to feel a lot of your kind of lateral hamstrings firing with this one. So we're going to go 10 reps with internal rotation, and then we're going to go slight external rotation and abduction. So going with the long way of the roller. And again, we're squeezing the roller as we're extending the hip. So we'll feel a little bit more glute with this one, still feeling some adductors in a more lengthened position. We want to make sure we're keeping the inner part of our arch on the ground and we're not completely rolling to the outside of our foot. You can see I am just slightly. Okay, and then we're going to finish with 10 reps in a more neutral foot position. So foot directly in line with the knee. You're going to feel much more glute with this. So just make sure you're getting full hip extension. Try not to use the back so much. So keep that strong posterior pelvic tilt at the top. So 30 reps total. You'll notice you'll get a good burn through the adductors and the glutes with this, and the hips will be feeling good. And lastly, we're going to get into a standing position. I call these standing tornadoes. So you're going to flex the hip to around 75 to 90 degrees, and you're just going to swivel the foot around in a circle, like you're stirring something up. So we want to use momentum with this. We're going to do about 20 repetitions to one side and then go the other direction. So this shouldn't be very slow. We should use kind of momentum of the torso to just kind of let the hip fly. You don't want to be feeling any pinching in the hip, so back out of hip flexion if that's the case. So again, we're just kind of swirling the foot around. If balance is an issue, a lot of times people will feel more of a burn on their standing leg because of maybe weakness through the glute medius. But again, if balance is an issue, hold on to something. So go through one round of this daily or throughout the day. The idea is to just get some low intensity, high frequency movement in, which promotes healing. We're not trying to build capacity here. Okay, this injury didn't happen because you're weak or inflexible. We could save the capacity building once the pain has subsided. So enjoy.